Good morning, students. In last class we learned various topics in reproductive health like population explosion and contraceptives and the qualities of ideal contraceptives and various methods of contraceptives like natural method of contraceptives and barrier method and IUD, that is intrauterine devices. Today we will learn oral contraceptive. What is meant by oral contraceptive is nothing but it taken orally, the method to prevent unwanted pregnancy and to method to give space between the children's. The contraceptive used by the peoples orally. Orally means through mouth. So oral contraceptive is normally it's a tablets, oral pills. Various brand name of oral contraceptives available like Mala D, Mala S. Various contraceptive pills are available in the market. The oral contraceptive only for the female. So again, contraception is nothing but the method to prevent unwanted pregnancy. So for preventing unwanted pregnancy, for giving space between the children's, normally couples use contraceptive methods. In oral contraceptives normally used by the female only, not for the male. Oral contraceptives normally contain a tablet which consists of hormones like estrogen and progesterone. Some oral contraceptive tablets which contain only estrogen, and some oral contraceptive contains only progesterone, and some oral contraceptive contain both progesterone and estrogen combination. So progesterone and estrogen combination is example like Mala D, Mala S. Various pills are available. The pills are taken orally by the female. For normally the menstrual cycle means 28 days. In female menstrual cycle is 28 days. In 28 days, first 5 days, 5 days to 7 days, it's actually menstruation. Then after ovulation and all the things are happen. Actually the oral contraceptive taken by the female but the period of 21 days after the menstruation. So compulsory the oral contraceptive taken orally by the female. For example, 8th day the female taking one oral contraceptive as a tablet. 8th day it's preventing the pregnancy. But in 9th day again the female taking another one oral contraceptive pill. Then only the pill which prevents the fertilization and pregnancy in the 9th day. Again the female take another one tablet in the 10th day, then only it preventing the fertilization and pregnancy in the 10th day. So compulsory in oral contraceptive, in particularly progesterone and estrogen like Mala D and Mala S, it's take 28 days. In 28 days, 21 days compulsory the female take the particular pills or tablets, means in the particular 21 days the fertilization not occurs and pregnancy not takes place. Suppose the next month the female desire to having children, fertilization means the particular female stops the oral contraceptive, means again in the next after 21 days it's the female capable to producing ovum as well as fertilization and the pregnancy also takes place. It is actually a temporary method of oral contraception. When the female desire to take to having a children, means the particular female stops the oral contraceptive, then in next menstrual cycle the ovum is produced normally and fertilization and pregnancy and takes place normally. Okay, that is the oral contraceptive. The use inhibits the ovulation. Ovulation means due to the hormonal imbalance, the ovary is not producing the ovum. Thereby, without ovum, sperm also comes, but without ovum, fertilization not takes place, and embryo development and pregnancy also not takes place. So, oral contraceptive in a particular method, it prevents the ovulation, inhibits the ovulation. Ovum is not produced during these 21 days. Then implantation also is not occurs in the uterus. So, the oral contraceptives, it is used by the female to prevent unwanted pregnancy and giving space to between the children, and this method has some side effects, less side effects, not more side effects, less side effects. The oral contraceptives is nowadays useful in urban as well as rural peoples also. Mainly in urban areas, the maximum female using this type of oral contraceptive, but it takes compulsory in 21 days after the menstruation. Then after 7 days or 5 days to 7 days menstruation, during menstruation time the ovulation not takes place, so the oral contraceptive also not needed. Then after 7 days after menstruation, again the female taking a particular oral contraceptive, then only it prevents the pregnancy and the fertilization. Okay, that is actually first method in the simple Mala D like Mala S tablets, oral pills. Then Central Drug Research Institute in India, Central Drug Research Institute Lucknow are producing another one type of oral contraceptive pills, that is Hageli. The oral contraceptive pills is like a tablet only, but the oral contraceptive Hageli pills is prepared from non-steroidal combination without much chemicals, which only less side effects. The first method, sometimes it causes some side effects, but in the second method like Hageli, the oral contraceptive tablet, pills produced by the Central Drug Research Institute Lucknow, it is actually taken once a week. But in previous method, compulsory the tablet or pills is taken compulsory all the 21 days to prevent pregnancy. But this method is Hageli tablet or Hageli pills once a week enough. For example, 28 days, 4 weeks means 1 week menstruation, again 3 weeks, 21 days, week 1 enough, only 3 tablets enough for preventing the fertilization in a month. But in last method, 21 oral pills is needed, here only 3 tablets or 3 pills is enough for preventing the fertilization and pregnancy in a particular month. Okay, these are all normal brand and variety of various brands are available in the market. So, the second method is the Hageli is oral contraceptive produced by the Central Drug Research Institute Lucknow, and the next method is implants. Implants is nothing but the small or chip like structure which contain progesterone and estrogen like hormones, which fixed under the skin, subcutaneous layer of our skin, if any part of our skin, it slowly releasing estrogen as well as progesterone, which controls the estrogen and progesterone hormones. So, totally it's prevent the fertilization and the pregnancy. Suppose for female is not taking the particular Hageli and other methods of oral contraceptive, means it is actually fixed into the body under the skin. This method is also preventing the fertilization. The particular female is again wants to have a children, means we remove the implants, again the fertilization takes place and ovulation takes place and the pregnancy also takes place. Okay, this is another method. It is implants, is actually a short time duration, first method, but in the implants it takes 1 or 2 years duration or maybe 1 year. And next method of contraceptive, that is emergency contraceptive. Emergency contraceptive means normally these methods like in the malady, first oral pills and the implants and the sageli, all these methods, it prevents pregnancy only the particular tablets or pills taken before the fertilization. But the second method, this is emergency contraceptives. The contraceptive used after the fertilization also, it gives the particular result. It prevents the pregnancy. For example, casual unprotected intercourse or coitus. After the intercourse, after the coitus, the female taking the particular emergency contraceptive means it prevents the fertilization. Okay, it is actually after the fertilization, after the coitus, after the reproduction, after the coitus, after 72 hours of coitus also, it is effective for preventing the pregnancy. So, normally the previous methods only before fertilization you take the particular pills means it prevents fertilization. But this last method is emergency contraceptive pills, it prevents the fertilization even after the coitus also, even 72 hours of the coitus also it prevents the fertilization. After coitus, after 72 hours, after 3 days, you take a particular oral pill means it prevents the fertilization. Okay, this is the emergency contraceptive, it's cause some side effects. So, normally these are all the methods for the oral contraceptives according to a particular choice, according to the couple's choice with the consideration of the qualified medical professionals. Couples use any one of these methods. Okay. Then the next, permanent fertilization, permanent preventing the fertilization permanently. These are all temporary methods, even natural methods, in barrier methods, and in previous class we learnt IUDs, intrauterine devices like copper T, intrauterine devices. And these methods are all temporary methods for preventing the fertilization. The next method is permanent method, that is sterilization. Sterilization is nothing but the permanent method of contraception. For example, the female or the couples already have 3 children. The couples not need any more children. Then the couple use the sterilization or permanent family planning method. These are actually permanent method. It is not reversible. Once the sterilization done, again and the particular couples is not able to produce the offsprings. But in certain cases able to produce the offspring, but naturally and the particular method is preventing unwanted pregnancy as well as its gap between the children's, but it is a last method, terminal method for the contraception. So, once the sterilization done, only less chance to having the children. Okay. Then sterilization is in male, one type of sterilization is nothing but vasectomy, and the female is nothing but tubectomy. So, generally the sterilization is known as family planning. Family planning generally we call in vernacular language family planning operation. Family planning is nothing but is medically sterilization. One method is vasectomy and another one method is tubectomy. Vasectomy is nothing but male fallopian mass difference. Normally we learn female and the male reproductive structures in previous classes. It's actually a small idea about male reproductive organs and the testis and vas deferens tube which carries the sperm from the testis to the external genital organs like penis, and here also another one testis are present. In vasectomy method, vas difference means nothing but the tube which carries the sperm from testis to external genitalia organs. In vasectomy method, doctors cut the vas difference and tie the vas difference. Then the testis produce sperm. The sperm is not enter into the particular vas difference, but vas difference is cutted, so sperm is not enter into the penis or external genitalia organs. Even a coitus, even copulation also, this male gamete sperm is not enter into the female area like vagina and cervix, so no fertilization takes place. Okay, this is a permanent method of family planning in male, that is vasectomy. In vasectomy method, in male reproductive organ, vas difference, both the vas difference, right side as well as left side vas difference are cutted and tied. Due to this vasectomy, testis produce sperm, that is male gamete, but the male gamete is not or up to or 50% stage travel, but after that it is maybe cutted, so the sperm is not enter into the another tract, and it is not enter into the female reproductive organ also, so the fertilization not takes place. This first method is vasectomy. An incision, actually the incision means a small opening. How the vasectomy is done means, normally you know testis is covered by the scrotum, a sac like structure is covered the scrotum, that is cover the testis is scrotum. It prevents the high temperature, it maintain the low temperature to 2.5 degrees Celsius as compared to the body temperature. Then only spermatozoans like sperms are produced. During this vasectomy operation, a small opening in the scrotum and lightly the cut the particular vas difference, and it's a simple surgery only, is not a complicated surgery for the male. And the next one method is tubectomy. Tubectomy is nothing but in female genital area, female, you know, female reproductive organ already I have studied. It's actually the ovary, fallopian tube or the oviduct, uterus. Here only the implantation and fertilization. Fertilization takes place in the fallopian tube, particularly ambulatory isthmic junction of the oviduct or fertilization. Here this is vagina and the cervix, cervical area, and this is uterus. Here only the fertilization, after fertilization, implantation and developing of fetus and child develops. In tubectomy method, fallopian tube or oviduct are cutted and tied. Even both the sides of the oviduct are cutted and tied. In this case, in the tubectomy case, is actually a permanent method of family planning, sterilization method for the female. In this method, the tube, fallopian tube are cutted and tied. And in this method also, ovum are produced from the ovary, but ovum is moved in some birds, but due to the connection, you cut the connection, so ovum is not moved into the oviduct, and in the uterus even fertilization also not takes place. Okay, this is the next method, tubectomy. So generally called a vasectomy for the male family planning operation, and the tubectomy is nothing but female family planning operation. In the both the sides of, not one side, in the both the sides of oviducts, it cutted and tied. Due to this, fertilization not takes place. It is a terminal method. After this sterilization method, the female is normally not able to carry the children. Okay, but sir, one question. So, fertilization, tubectomy occurs or tubectomy operation over, sterilization over, but the female forms a menstruation or produce a menstrual cycle or continuing the menstrual cycle mean yes. Menstruation is actually takes place inside the uterus. in the endometrium of the uterus, blood vessels and mucus are corroded after the particular menstrual cycle. It oozes out through the vagina, that is menstruation. In tubectomy sterilization method, only we cut the particular fallopian tube, it not any perform any changes in the uterus. So menstruation process occurs inside the uterus and through the vagina it oozes out. So even after tubectomy also, ovum only is not entered into the fallopian tube, fertilization only takes place, but all the events like menstruation, hormonal production, estrogen, progesterone, hormones, all the hormones is normally produced in normal level, and menstruation is not anyway is affect the menstruation. It affect only the ovum production, is not exactly affect the ovum production also. Ovum also produced, but it retards the movement of the ovum. It control the movement of the ovum. Okay, these are all the methods. It's actually contraceptive. Normally in the last class we will explain. I explained various contraceptive methods like natural method, barrier method, and intrauterine devices like copper T and copper S. In today I explain oral contraceptive, various methods of oral contraceptive, then sterilization and the permanent method of contraception like in vasectomy and tubectomy, and the effects of vasectomy and the tubectomy. In some persons, normally and the couples afraid about these contraceptive methods because it's actually against the natural way. Normally, naturally sperm are produced, ovum are produced. We take artificial variety of chemicals or with the use of various chemicals, or we perform surgery in this like sterilization, is actually against the natural method. So in some couples afraid some effects, maybe some side effects. Yes, all these methods has some side effects except the natural methods. Side effects means like nausea, breathing problem may occur due to over taking of hormones like tablets or other methods. Sometimes it's nausea, like breathing trouble, and in sometimes in abdominal pain because the uterus are present in the abdominal area. In IUDs, intrauterine devices, in the uterus only the copper T, the T like structures are fixed. So in some persons in the copper T which cause some side effects. Okay, some side effects. So due to this in abdominal area pain may occur in some persons, not all the person, and in some times in the bleeding like a menstruation, break through the bleeding also heavy in some person, not all the person. For example, 100 persons are using contraceptive means only 1 or 2 cases. Some side effects like breakthrough bleeding and irregular menstrual cycle also takes place. Normally 28 days the menstrual cycle time, in some times it takes 35 days. In menstruation also 3 to 5 days or 3 to 7 days. In some persons 15 days. Even 20 days also menstruation takes place, or due to health condition or due to we using various methods of contraceptive. Due to these methods, some side effects like irregular menstrual bleeding, and even these last cases breast cancer also, uterus cancer, cervical cancer also, sometimes not all the time. In 1 lakh person means or 10% which are affected by these are all the some side effects. Okay. So it is it's 99% is advantage to reducing the population, to controlling the population, and to controlling unwanted pregnancy and give space between the childrens. The contraceptives are useful only 1%. It has some side effects also. According to the doctor's advice, with the use of qualified medical advice from the qualified medical doctors, we use any one of the contraceptive methods means with the guidance of the doctors. So normally, surely we avoid unwanted pregnancy and giving space between the children, as well as even some sexually transmitted diseases also prevented by this one of this method. Okay, this is a contraception and various methods of contraception and some side effects of contraception. In next class, medical termination of pregnancy, how abortion takes place, how MTP, medical termination of pregnancy, and the next sexually transmitted diseases, and next infertility. Okay, learn your topics in your NCERT book. In next class, we'll deal the next topic. Okay, thank you. Good morning, students. In last class, we learned various methods of contraceptives and temporary as well as permanent method of contraceptives. Today, in continuation of the last topic, medical termination of pregnancy. What is meant by medical termination of pregnancy? MTP is nothing but voluntarily or intentionally we terminating the pregnancy before the full development. For example, normal pregnancy time in human being is 9 months. Before 9 months, voluntarily, involuntarily may happen due to accident, due to stress, due to underdeveloped child, abortion or medical termination of pregnancy taking place. The medical MTP is nothing but like abortion, but voluntary abortion. Naturally, abortion may takes place before the full term, but in intentionally, voluntarily, we aborting the child. We aborting the child before the development, before the full term development. For example, 9 months is the pregnancy time. Before 9 months, we voluntarily, we intentionally aborting, terminating the development of child means the method is nothing but MTP, medical termination of pregnancy. That is nothing but induced abortion. Naturally may happen, but voluntarily, intentionally we aborting the child means there is nothing but MTP, is otherwise known as intentional abortion. Intentionally we abort the child. Okay. So normally human population in India and even world population, human population is more. In year, in world wise, 40 to 50 million MTPs are occurs in the hospitals. Means is nothing but, for example, 5 peoples fertilized get pregnant means out of 5, 1 people or 1 person voluntarily, intentionally terminating the child development. For example, 5 in Namakkal area, 5 people get pregnant means voluntarily, out of 5, 1 it's used MTP, medical termination of pregnancy, aborting the child, that is induced abortion. Okay. And in various in India, the abortion level in some places is more. And Government of India passing variety of laws in 1971 to controlling the MTP. Normally MTP means is nothing but is induced abortion. Suppose couples not need a particular female child means with the use of MTP technique we aborting the child. So government plan to restrict this aspects to controlling the child growth. So government initiate various plans and provide and formulate various laws regarding the MTP. After 1971, the MTPs performed by the doctors, not any nurses or any other professionals. Suppose we are moving to unqualified quacks. Unqualified quacks is nothing but unqualified doctors. So MTP is performed by the unqualified doctors means even it is harmful to the child as well as harmful to the mother. Okay. So government initiating various laws regarding the MTP to controlling the MTPs. MTPs is useful because it controls the population. It's space between children like our last contraceptive methods, but in some peoples use this MTP for preventing the female child. For example, with the use of amniocentesis method, the couples checking the sex of the child with the use of chromosome analysis. So, after analysis, for example, the developing child is female, means the couples illegally move to the unqualified doctors, and with the use of MTP, medical termination of pregnancy, they abort the child, particularly female child. So, various cases occurs in, before 1970s, but after 1971, the government initiated various laws to controlling the MTPs, medical termination. Only the possible, the correct reason means the MTP is allowed, but in improper reason means the government is banning the MTP. Okay, then the MTPs, first trimester MTPs is safe. First trimester is nothing but first 3 months of pregnancy. Normally, 9 months pregnancy time female, first 3 months is first trimester, second 3 months is second trimester, and third last 3 months is third trimester. In first trimester, the MTPs is benefited by the particular female as well as in the child, no side effects occurs. But in second trimester, MTPs is more riskier, because in second trimester means 6 months, or 4, 5, 6, 3. For example, 6 months child development is approximately 50% or 60% takes place. In 60% child, developed child get aborted means it causes some side effect to the mother as well as the child. Child may be, but the mother has some problem. So, first trimester, particularly 12 weeks of MTP is allowed, is acceptable. It is not cause any problem to the mother as well as the child. Child means if actually developing fetus only, it is not cause any, mainly not any cause problems in female, particular mother. So, second trimester means it cause some problems. Okay. So, government initiating various laws, this normally generally is not in NCERT. In first trimester, abortion means one qualified medical practitioner sign is important. After consideration of one qualified medical practitioner only, and the MTPs is allowed in first trimester. In second trimester means 2 qualified medical practitioners as well as some discussion with other practitioners. Practitioners means nothing but doctors, only allowed. And third trimester in next severe cases. Okay. The MTP is useful for example, female variety of problems occurs in the female day to day life, we will learn from the medias. So, due to rape or unprotected casual intercourse, some female get pregnant means the only method is MTP, medical termination of pregnancy, terminating the development of the embryo before the full term. Okay. It is the only way for the above said cases. Okay. That is, MTP is nothing but medical termination of pregnancy, voluntarily, intentionally we aborting the child. Okay. Government has some rules and regulations for the MTPs, and according to the rules and regulation, the couples not need a particular child. Already the couple has more child, means the next child is not needed by the particular couples, means the MTP is allowed. In this case, MTP is allowed. Suppose, for example, the developing child has some problems, developmental problems, chromosomal disorder, Mendelian disorder means the MTP is useful. But the undeveloped or chromosomal disordered child, it is not useful for the society, but it cause some problems also. It's reduce the economy as well as it affect the economy also. So, in these cases like unwanted casual intercourse and rape and unprotected sexual intercourse and some genetically disordered developing child, in these cases MTPs is advisable. To controlling the population, MTPs are advisable. by the government. But in other cases, like in the female foeticides, to check the child sex, and after that MTP is performed, means according to the law it is not possible. Okay. So, MTP is nothing but medical termination of pregnancy or induced abortion. Okay. Before the full term we aborting the child, it is MTP. It is proper reason means it is good, but in improper reason means it is controlled by the government laws, it is not possible. Okay. So, learn your topics in your NCERT in next section, in the next topic, like sexually transmitted diseases and infertility, one by one I explain. Okay. Thank you.